Thank you very much, Ciarán, and I welcome the opportunity to contribute to this. I did contact the Minister's office and clarified that it's actually an MRI scanner as opposed to a CT scanner, so I hope you got that clarification. This is an essential piece of infrastructure for the Midlands region, and currently any patient in Midlands Regional Hospital Mullingar has to be referred to either Tullamore, that's the adult patients, and the paediatric children are being referred to Dublin. And given the fact that Mullingar is a paediatrician hospital for the Midlands, this is simply unacceptable as it's having seriously long delays on our patients. And just to give you a brief history, Minister, you may not be aware, a number of years ago the HSE promised the community of Mullingar that if they paid for the scanner, the HSE would stump up and they would build the unit and would staff it with the specialist staff. Now, I want to acknowledge here on the floor of the House the Friends of Mullingar, the hospital group that was established. And thanks to so many fundraisers, both small fundraisers and big fundraisers. We had a fundraiser in the memory of the late Johnny Murphy, raised €205,000. We had cake sales, we had 5K road races. Families climbed Croagh Patrick, schools had pyjama days and crazy hair days. So there was an array of fundraising efforts. And because of those fundraising efforts, the target has now been met. So the MRI scanner funding is in place to purchase the scanner. The department did, I acknowledge, approve to bring the building to a design and planning stage. And the HSE officials have, over the last number of months, been engaging with the planning authority to try and address any of the obstacles that could be in the way when an official planning application is to be made. I understand now that many of those obstacles have been addressed, many of the challenges have been ironed out, and it is anticipated that a formal planning application will be made by the HSE to Westmeath County Council in a matter of weeks. So the reason why I raise this issue today, Minister, is I raise it in order to seek and ensure assurances that once this planning application is approved, and it's anticipated we're talking about in a matter of months now, that there will be no delay in advancing resources in order to bring it to the next and final stage, and that is to bring it to tender and construction stage. Because I said this is an essential piece of infrastructure for early diagnosis, for investigation of many conditions including stroke, cardiology, for people attending surgery and for people attending the casualty unit. And it's critically important from the point of view of Mullingar is the main maternity hospital for the Midlands. And anybody who knows maternity will know that any baby that's born prematurely, it is best practice to ensure that they have an MRI scan. So it's critically important. We have come a long way, thanks mainly to the efforts, the Trojan efforts of the Friends of the Mullingar Hospital Committee, but also to the huge voluntary efforts of so many people who have conducted and arranged so many fundraisers. The funding is in place for the MRI scanner. We're ready to go in for planning application to Westmeath County Council in a matter of weeks. We should have planning application within a matter of months. And what I want today on the floor of the Dáil is assurances that there will be no delay in advancing the necessary resources to bring it to tender and construction stage.
Thank you, Deputy Troy.
Minister. Thank you, Chair. Thanks. And on behalf of Minister Harris, thank the Deputy for the opportunity to update the House on the capital development project for the Regional Hospital Mullingar. The Regional Mullingar Hospital is a Model 3 hospital delivering a 24/7 emergency department, general medicine, including regional stroke, thrombolysis, general surgery, obstetrics and gynaecology, paediatric, special care baby unit and critical care, alongside a range of local and regional services on an inpatient day case and outpatient day basis. The catchment area for the Regional Hospital Mullingar includes patients residing in Westmeath, Longford and the Greater Midlands area. The significant population increase in the Midlands area, coupled with other factors such as ageing demographic pressure has placed significant additional demands on the hospital. As the Deputy will be aware that a number of distinct proposals for developing a regional hospital in Mullingar. I understand the submission for capital work to accommodate the provision of a second CT scanner for the regional hospital in Mullingar is currently being prepared by the hospital management in conjunction with local HSE estate office. The submission we have is to consider by the HSE Capital Steering Committee before it can be approved. The application for a second CT scanner for the hospital will be also considered in the context of all of the priorities medical equipment replacement requests across all acute hospitals and subject to the availability of capital funding. The provision of a new MRI at Regional Hospital Mullingar is included in the proposed new extension of the radiology department in the hospital. The project team are currently at the advanced stage in pre-planning process with a view to lodging a full planning application in Q1 2019. The HSE intends to complete the design of the project in 2019. And I understand the Friends of Mullingar, which the Deputy has already said, have completed substantial fundraising to support the MRI and acknowledge their contribution. And the Minister would like to acknowledge their contribution. The timeframe for the completion of these capital projects will be subject to the successful completion of the plan and permission process and the availability of capital funding. Minister Harris is happy to confirm that the provision of the new MRI at Regional Hospital Mullingar has been included in the National Development Plan announcement last year as part of Project Ireland 2040 policy initiatives. The NDP provides £10.9 billion for health capital development across the country, including both national programme and individual projects across acute primary care and social care. The delivery of the NDP project and programmes, including development in Mullingar, will result in a healthcare facility that will allow the implementation of a new model of care and for delivering of services in high-quality modern facilities. The Department of Health and the HSE are currently engaged in a process to facilitate the HSE Capital Plan for 2019. The HSE Capital Plan will determine the projects that can be processed in 2019 and beyond, and have in regard to total availability of capital funding and the relevant priorities of each project. All health capital projects currently at various stages of development, such as projects at the Regional Hospital Mullingar, are included as part of this process. Once the HSE has finalised its capital plan for 2019, it will then be submitted to the Minister for Health for his consideration.
Deputy Troy,
thank you, Cathaoirleach. Minister, I accept that you're only here to represent Minister Harris and that you don't have, I suppose, the authority to give any definitive commitments. You're given a script to come in and read out, and a lot of the information is not new because, to be fair, I can read Project 2040. I've read Project 2040. I know what's in Project 2040 in relation to my own constituency and indeed in relation to the Department of Transport, Tourism and Sport. But in the context of the last number of events over the last number of weeks and number of months, and even by the admission by the government themselves, certain projects are going to be reprofiled, I think is the word that you use to describe delays in project. I just want to put it on the record of the Dáil here this evening, and I had hoped Minister Harris would be here, because you can bet your bottom dollar that when the project is finally announced, he's not going to give you the job to announce it. He'll come in and take that glory himself. But we have, and the people of Mullingar have honoured their commitment. The HSE made a promise that if the people of Mullingar fundraise and have the funds raised to the tune of €950,000, not small fry by any manner of means, that the HSE would not be found wanting. They have honoured that commitment. The people of the Mullingar and the wider hinterland of Mullingar and Westmeath and indeed across other counties have contributed. We have honoured that commitment. Now we want to receive assurances that the cost overruns in the Children's Hospital is going to have no impact on the delivery of the building for the MRI scanner. It's essential. I outlined the reasons why it's essential for the region, and I want to receive assurances that there will be no reprofiling of this the facility to house the MRI scanner for the Midland Regional Hospital, Mullingar.
Thank you, Deputy Troy. And final supplementary.
And to
reply.
assure the Deputy, and I'm not here for any glory, to be honest with you, but just let's... Pardon? OK, the Regional Hospital Mullingar is an integral part of Ireland's Eastern Hospital Group, providing health services and care for people of Westmeath, Longford and surrounding areas for the Midlands. The hospital provides quality patient delivery, as you already said, by the skills and valued staff through the best of their available resources. This has been achieved first and foremost through the commitment, hard work and professionalism of all the hospital staff. This government is committed to developing service and infrastructure in the Regional Hospital Mullingar. And Deputy Troy, if you're looking for me to tell you that any further than that, I can't give you a commitment standing here that this particular project is going to be funded. I think that's something that we'll have to wait for when the capital plan is the plan is announced and the capital funding is announced. And then at that stage, then I think there will be obvious to everybody what plans will be going ahead. And I can assure the Deputy and other people sitting here, as far as I'm concerned with the new National Children's Hospital, which is very much needed, I can guarantee you that there won't be projects cancelled. I have heard it from the mouth of the Taoiseach and for the Minister. Maybe projects might have to be put back a piece, but they certainly won't be cancelled. Well, we'll call it what you like. I don't think we're in a position at present to stand up here this afternoon and announce that the Mullingar Hospital will receive that funding. I'm certainly not able to do that, but I can acknowledge the work and the hard work that's done by right around the country, lots of community groups who on a regular weekend basis fundraise for all different kinds of things in hospitals and outside of hospitals as well. And just to thank the people of Mullingar and the surrounding area for that, because without many people putting their shoulder to the wheel, there's an awful lot of things in this country wouldn't actually happen. And I know that as a community worker myself, I will bring your concerns and your frustration and your response about the capital funding. Unfortunately, Robert, I'm not in a position to announce what kind of funding is available, but I'm sure in time that will come very clear to all of us.